So my name's Holly Noble, and I was born and raised in Miami Beach, and my practice is actually in Miami Beach in Mount Sinai Hospital. I've been in practice since 2013, so I'm relatively young. However, I feel I've accomplished quite a bit in that time, and I also incorporated the gyrotonic expansion method in my practice as well, which is a very dynamic movement system. My practice is in Mount Sinai Hospital, where I'm in private practice, so I do have like an outpatient clinic. However, I am a teaching rotation site for the internal medicine resident doctors in Mount Sinai, and this is the first time that they've ever had Chinese medicine integrated in their internal medicine residency program. And I came to this seminar, I had always wanted to learn the TAN method. I felt that I had heard so many good things about him through the years, even when I was in school, before I was even a practitioner. So I had heard just amazing things, and for whatever reason, I just didn't get around to his training. So there's always a time for everything. So I saw that you guys were here last year, and you were in this goal of yours. Well, I mean, as a TCM practitioner, I feel that this is a very efficient way to treat patients, and I feel that especially, whether it's an inpatient or outpatient setting, I think especially for an inpatient setting where the volume is very a lot heavier, you don't have as much time necessarily with the patient. So I think for faster volume and inpatient, I think it would work very well. And plus, another thing too is I like all the distal needling. I like that system, and I think that it's, aside from being very efficacious, it's also very safe. It's less time patients spent getting declothed, and so it just seems like a really efficient and effective system. And it's beautiful, and it also retains the integrity of Chinese medicine, and that's something that's near and dear to my heart, because I'm not as drawn to systems that are kind of trying to do something else, and it doesn't make sense. And I'm very much, even though I'm in an integrative practice, I'm also very much all about, I'm a Chinese medicine practitioner. This is the integrity of this medicine. It should be, retained. So I like that aspect.
That's nice. How's your experience?
The seminar is spectacular. I am having such a great time. I'm so inspired, and all of these light bulbs are going off, and I'm having all of these incredible ideas, and I want to learn more, and I'm already thinking, okay, when's the next seminar, and maybe I should go to Israel and visit your hospital, which I'll be in Israel anyway in the spring. But I think that the teachers are absolutely, not only are they dynamic, they're engaging, they're so knowledgeable, and it's just been an absolutely spectacular experience. Yeah, so I'm loving it.
It's fun.
Most important too, I find that when you're learning a modality that's so different than, well, it's not entirely different because I've learned tongue stuff, and so there's things that are similar in microsystems, but you're still learning a whole other system, and sometimes you have to just shut off, the part of your brain that's so used to doing what you're doing, and even if it's great what you're doing, you still have to kind of, close that off, allow yourself to be an open vessel, receive the information. And a lot of times when you're learning new sort of treatment approaches, it can be a little tough, it can be a little bit confusing. And I have not found anything to be confusing. And if it was for a split second, somehow, miraculously, one of the teachers explained it so impeccably that it wasn't. So there's been a very low confusion percentage rate. So, and the information is very easy to understand. They present it in such an easy way. Because sometimes learning some of these distal approaches, I know when I learned some master tongue, it was, some of it's a little confusing the way that, the way they teach, it's so easy to understand. It's like effortless, which I'm sure they put tremendous amount of effort into developing this method to teach, and they've done an outstanding job.